So without further ado, our first live speaker for today is none other than the Chief Executive Officer of Manila Kidney and Prostate Care Clinic. Let's give a very warm welcome to Dr. Rogelio Varela. Good afternoon, Dr. Varela.
Hello, good afternoon, everybody. Thank you for having me here. We have witnessed in the last few decades how science and technology has evolved. Let us take the cellular phone, for example. In the early 80s, cellular phones comes with a little bag where the main module is placed. A few years later, it became a little more compact, now the size of the usual home telephone handle, but still a lot heavier. The 90s was the golden era for telecommunication giants such as the Motorola, Nokia, Sony Ericsson, BlackBerry, and of course, Apple. It was a battle of features and size. The smaller the unit is, the better. However, those who favor innovation will fare the most. When Apple decided to take the other road that no one thought existed, the world of handheld phones took a 180-degree turn. It did not only change how the cellular phones used to be, it also changed the way we now utilize it in our daily living. The modern-day cellular phone killed the camera and video industry. Casio's production of calculators went down. Some people stopped wearing wristwatches since their phone can now tell time. Who among you can still remember tungsten palm top? I bet the younger generations might have thought that it existed in the 80s, but mind you, it was a popular device in the early 90s and it only went extinct only during the early 2000s. When Apple introduced the iPod, those who favor innovation will fare the most. The field of medicine and healthcare also took a bite in this constantly evolving technology. Innovations for both treatment and diagnostics soared for the last few years. Transurethral resection of the prostate, or the TURP, has always been the gold standard for the treatment of benign enlargement of the prostate. And this is a type of minimally invasive procedure where the large prostate that is causing urinary obstruction is being removed. However, because of technological advancement and the development of the use of lasers in surgery, more and more surgeons are leaning towards the use of thulium laser prostatectomy. Why? Both the TURP and the thulium laser prostatectomy can relieve the obstructions of the enlarged prostate, and both involve passing a scope inside the urethra of the patient just to gain access to the prostate. Comparing the cost, patients will have to pay twice or thrice the amount in thulium laser prostatectomy versus the traditional TURP. But why do we favor thulium more? Patients who will undergo thulium laser prostatectomy will have a shorter hospital stay and a minimal to no blood loss at all. And more patients are satisfied with it as compared to the former gold standard for the treatment of enlarged prostate. One of the more important objective of technological advancement in the healthcare sector is to identify the cause of the disease at the most non-invasive manner at the shortest amount of time. MRI, for example, for the past few years, has gained its popularity as one of the imaging modality for soft tissue tumors. However, for the past few years, it grew popular amongst the urologists because of its use in identifying prostate cancer. And male patients with elevated PSA with high index of suspicion for prostate cancer need not undergo immediate prostate biopsy. This allows the urologist to be more conservative in his or her approach to diagnosis of prostate cancer. Notice that in the last decade, starting off in the year 2010, there are many hospitals being built by private sectors within Metro Manila. Most are owned by doctors themselves as the primary investors. And these new medical facilities are slowly killing privately owned primary and secondary hospitals that was built back in 80s and 90s. And most of these are even family-owned hospitals. Why? because these new medical facilities can offer modern day diagnostics and treatment for everybody. Since more and more of these are being developed, the cost of service also goes down, making it more favorable for the patients. Those who live in the outskirts of Metro Manila may not have to get up early and travel great distances just to have the MRI that they need, because it is now already available in a newly built health facility near where they reside. Old hospitals should upgrade their diagnostics and treatment services in order to thrive. Otherwise, more patients will leave them for a better and more advanced healthcare facility. To end, again, I will reiterate, those who favor innovation will fare the most. Hospital facilities, even clinics, should innovate services through upgrading equipments. And facilities should need also changes in infrastructure, changes that will fit the needs of our patients today. Services that we used to be giving out to our patients 10 to 20 years ago may not be suitable today. Remember that our ultimate objective is to help our patients get the right treatment they need in the swiftest possible time. Again, welcome to the first Philippine Healthcare Modernization and Digitalization Virtual Summit. Good morning, everybody.
Thank you very much, Dr. Rogelio Varela. Again, ladies and gentlemen, he is the Chief Executive Officer of Manila Kidney and the Prostate Care Clinic. Sir, thank you very much for taking the time out of your very busy schedule and sharing your expertise and knowledge with us. And I'm sure the 500 plus viewers in our Zoom meeting room right now is very well appreciative of what the technology has brought us to, especially within the healthcare sector. Okay, so I don't think there are any questions from our audience right now, but yeah, just a reminder, if you have any questions to our speakers, please feel free to put it in our Q&A box that can be found at the bottom of your Zoom screens, and I'll be more than happy to relay it to them. Okay, again, ladies and gentlemen, that was Dr. Rogelio Varela, CEO of Manila Kidney and Prostate Care Clinic. Okay, so at this point, I would like to